What's up, guys? Welcome to another episode of the Medicopolis podcast, where two teenagers discuss medical dilemmas and police them to reach an ultimatum on whether the situation is ethical or not. Thank you so much for taking the time out of your day to listen, and we hope you enjoyed the episode on our reflection of COVID 19.
So, for starters, telemedicine, which was something that emerged greatly throughout COVID 19, is a general term that covers every single way that a doctor can communicate with a patient online. This includes phone calls, video chats, emails, texts, and other online means. Any hospital can legally administer the option to patients, but there have been some ethical problems that have arisen during COVID 19, and problems that should be faced when dealing with other means of telemedicine, specifically with dealing with the patient relationship to a doctor and some of the privacy issues. So, I guess sort of jumping into it, one of the main problems that have been shown to happen with telemedicine is the importance of an in person appointment, which can establish a connection between the doctor and the patient. So, this is reflected with like a physician's emphasis on a detailed history and a physical of the patient. Physicians are taught about the importance of patient doctor relationships as a strong base for trust and empathy. The American Medical Association emphasizes that telemedicine should still be used as a supplement to live visits, and only for those patients with whom the practitioner has a pre existing relationship. So, despite these values of a live visit, a major opportunity that comes from telemedicine, despite not meeting the patient face to face, that I thought of, was that physicians in areas where in person care is limited, telemedicine can be a stand in for that by allowing the patient to have treatment and care with a doctor on standby whenever they need it. But I mean, Saj, do you think this is more of a benefit or more of a con about like relationships with physicians? Because I mean, with telemedicine, these things aren't that like that relationship isn't always going to be as face value as with like face to face relationships, but it should still be important and should still be realized that telemedicine provides a long range of coverage. So, I mean,
Yeah,
do you think this is really a benefit or like?
Yeah, I'll just jump into what you're talking about here. I mean, if we like rewind back to early on or in the earlier stages of the coronavirus when it was really the cases were increasing exponentially, it wasn't that there was limited in-person care. It was that in-person care was practically cut off completely at a certain point of time where people couldn't even go in. And I do think that the relationship between the patient and physician definitely declined, but I do think that unfortunately that was kind of the only way that it needed to work. But like as the American Medical Association has established, there should be a pre-existing relationship with the practitioner. That's when only telemedicine should be used. I do agree with that at this point in time, especially because now in-person appointments are an option, especially with masks. And I do think that while telemedicine doesn't really completely take away from that trust building and that relationship, but it certainly puts a little bit of an inhibitor on it.
So again, like, do you think that this could be a full replacement just looking at the sort of problems that come with the relationship between the patient, or do you think there should still be a buffer? Because at some point it needed to be a full replacement, but I mean, we saw that it didn't. While it did have a lot of benefits, there were still some problems establishing trust and mutual like agreements between the patient and the physician, which caused some problems in patients not getting the care they need. So, I mean, do you think that specifically for you, like, do you think that it'd be a good replacement or no?
Well, it depends. That's a good question. It depends on the person that you're talking about. I feel like and what their needs are, especially for like let's say an elderly person who's developed cancer and they really need that support, that in-person support, and have to have strong trust with their oncologist or whoever is treating them. I think it's important that they still have that option for in-person care. But for people like me, for just casual checkups. I think that telemedicine is a completely fine replacement. So really, my answer to this question is that it depends on the situation for both the person and what case they're dealing with, the degree of the degree of difficulty, so to speak.
Yeah, I can see where you're coming from that. So one of the other, I guess, sort of bad problems, not really bad, but one of the other problems that comes with telemedicine that some patients are facing is that some patients may not know exactly who will be sharing personal information. That information is available on different devices and computers depending on where the patient decides to log in for a telemedical appointment or where they're providing information like that, which can increase security breaches greatly, which can affect a patient's acceptance of telemedicine. Especially with asynchronous communication, it's very important to know exactly who will be responding to whatever situation that the patient has, because otherwise it could raise even more privacy concerns. Being cautious is important, especially given the uncertainties about this new delivery model of care. But security issues are more operational than ethical, is what I was thinking. So, new encryptions and security tools are made to protect these types of information, and to gain confidence, it is essential that a privacy and security plan from the company is needed, I guess, for any sort of telemedicine program. So, Saj, specifically, like to you as a more like healthy person who wouldn't really have to need too many telemedical appointments. Do you think privacy is something that would affect you as like a privacy issue is something that would affect you as greatly as like say I guess going back to your example, maybe a more senior citizen with a more terminal illness. Like do you think that problem of privacy is something that can affect everyone in a more general aspect? Or do you think again it's still more situational?
Well, I mean, privacy is something that I think should be respected for all, and regardless if I'm a super healthy patient that just only has to go in for the occasional checkup, or someone that's constantly coming back like a recurring patient in the hospital, I still feel like that value of privacy should be maintained equally for all of these patients. I'm not sure if that answers your question, but if there's a problem with the privacy on the operational level that you were talking about, I feel like that also is actually an ethical issue on whether or not we decide to act upon that operational issue. And so if there are issues with that, then I think there are systems out there. Like I know there's like Mosaic for radiation oncologists, which they use as a database to keep their information to maintain their patient confidentiality. But as I feel like there needs to be systems, either one created to maintain that patient level of what is it called, confidentiality, or there needs to be we need to go back to the old ways of face-to-face communication if it's absolutely necessary to maintain that confidentiality. Because I do believe, and I know many established organizations say this too, but it's really important to maintain confidentiality in the world of healthcare.
So this okay, so the problem of privacy being like an ethical issue was something that arose during the rise of telemedicine. But do you think that even with in-person care, that like problem with privacy that we face, do you think it's as big of an ethical issue there because people are saying a lot of their information more face to face? Or do you think that it was like I guess what I'm saying is do you think it's fair to telemedicine that this ethical issue of privacy comes up more so now versus when people were in person delivering information face to face? I guess that's what I'm saying.
No, I don't think it's necessarily correct to blame telemedicine because I still feel like there were a certain level of errors in that one-on-one communication as well. So I don't think we can necessarily blame telemedicine for these problems necessarily.
S- See, that's interesting because I think that telemedicine, especially with like how I said the issues are more operational, the fact is that's still on the fault of the company, which is still becoming an ethical problem if information is leaked. So I think personally, like even though there were ethical problems with privacy like during in-person like face-to-face sort of medical attention, I think that during the rise of telemedicine, we saw so much of an increase of these security breaches that I think that telemedicine should share some of the blame. I'm not saying all of it. I don't think that telemedicine like caused privacy issues. That's not what I'm saying because obviously there were issues with this system beforehand, just delivering information face to face. But I still think telemedicine should take some of the blame for it.
I mean,
Does that
I see what you're saying, but I do technically agree with what you're saying, but I think that telemedicine was the only viable alternative that hit when COVID-19 uh, like hit the United States and countries around the world. So like while yes there will be more security breaches, I mean if there wasn't any there would be no other way of treatment at all without telemedicine as far as I'm aware of, assuming that we're eliminating in-person visits. So I mean it would have been so much worse if there was no way of treating people at all. So yeah, telemedicine is technically to blame, but like that was the
So
only
you're
vault.
okay. So not to cut you off, but you're saying more just because it was our last resort and because we had to use it, it shouldn't share the blame of these privacy issues because it was more so like a new system that was put in place as a full replacement.
Well, we can't blame a system if the old system wasn't valid anymore, and that was the only viable replacement.
Okay, yeah. So you're saying as a final leg to stand on, you can't blame it for its problems because of the fact that it is there.
Yeah, blame is a tricky word that you're using right now,
Yeah,
but
yeah, yeah.
another huge part of COVID-19 was vaccines, and vaccines ended up becoming actually controversial throughout the United States, and I'm sure in many other areas of the world, which really ended up raising the question, should COVID-19 vaccines be mandatory?
So, really quickly, just to interrupt, a lot of the vaccine misinformation is not going to be discussed distinctly in this podcast. We're not trying to change someone's scientific belief. If you want to do that, go do your own research. We're just here to talk about mainly a summary of some of the ethical problems that came with it. Just saying.
Yep. And so vax so let's first jump into the history of vaccination in general before COVID-19 because I think that's really just important to discuss, especially when considering COVID-19 vaccine. So vaccines in general have been used very often throughout our history, especially in combating various pandemics as well as other diseases throughout our history, and they've been very effective public health interventions for both saving lives as well as promoting good health. And especially for talking about mandatory vaccination, it has been used quite often throughout our history. For example, so far, in all 50 United States, it is actually mandatory for children over 5 to receive vaccinations prior to going to school in state licensed public schools. I'm sure if you live in the United States, you've definitely experienced this before where you had to go in when you were a young kid. Maybe you don't remember. But the point is that mandatory vaccination has played a role in making sure that kids are safe in public schools. And and the government had United States government has already made measures out there to promote mandatory vaccination. So should COVID-19 vaccines be mandatory? What do you think, Ashwin?
So, specifically in children where the virus isn't as strong, or I guess where the symptoms don't show up as much, I feel like there's a definite argument to be made that the vaccine shouldn't be mandatory for them because if it's not as strong, but there's still the side effects that come with taking the vaccine, then there's not really a point for children to take it. But I guess, sort of in my opinion, looking at other viruses that we have faced, like influenza, children get vaccinated for those viruses at very young ages. For influenza, it's like at 6 months old. So if we have the resources available and children are, I guess, willing, or I guess if parents are willing, then the vaccine should be mandatory for kids of that age. And I mean, it's already sort of mandatory in some areas for everyone else. So I guess the argument that I'm making is that it should be mandatory for everyone because I mean, I guess unless there's underlying health conditions or other things like that. Because if like I guess looking at other viruses, there has been proof like saying that these vaccines work for other viruses. COVID-19 is no different. Like we if the resources are available, I feel like they should be used.
Yeah,
Do
but I
you I guess I could see the problems though. Sorry. With like how that might be a little too harsh for those like children, but that's just like sort of my take.
Yeah, but I just feel like in general, like let's say we talk about adults, there's adults that work in the public health sector that definitely need to be vaccinated because they're around the public a lot and we can't be having these people have a higher risk of COVID-19 because that could quickly caused a spike in cases again. But I don't agree with your point where it should be mandatory for everyone. When we're talking about those vaccines that are for kids, um, a lot of people have religious reasons as well as health reasons why they don't get those vaccinations. And so I do think that as long as it's not an idea of, oh, X person said that I shouldn't be getting a vaccine, therefore I'm not going to. I think that if these people truly believe that vaccines are not right, like they do not want to get a vaccine, it's not good to force them to get a vaccine against their will. I guess that's just kind of my ethical nature, despite what you say.
I can sort of see the health concern that you're bringing up. Like, if someone does have a health concern, they shouldn't get the virus or shouldn't get the vaccine. I agree with that. I think that's definitely a problem that we're going to have to face in getting everyone vaccinated because of those health conditions. As far as like religious reasons or just like misinformation, I feel like those problems specifically shouldn't affect like if you get vaccinated or not, which might be a slightly troublesome opinion, and it's possible that I'm just not seeing it from all perspectives. But I feel like when the problem isn't specifically health related, where it's something that's based off of a belief that doesn't affect physical well being, then there's a point where vaccines should be just used. Again, if that resource is available, but something is stopping you as far as like just sort of societal or like belief, I guess, like a religious belief, I feel like that shouldn't get in the way of getting something that will physically help your well being in almost every way. Which, again, like a vaccine, they do work. I don't see the problem with that. But I guess agree to disagree. So,
Yeah.
but of course, COVID-19 is a global pandemic, and as much as we could discuss about the ethics of American vaccine policies for hours, again, it's important to talk about countries where COVID-19 vaccines are mandatory and see how their vaccine plans, I guess, sort of impact like our ethics, our standings. So, I mean, for starters, there's some countries like Austria, Ecuador, Germany, Micronesia, Tajikistan, etc., where the vaccine is mandatory for all adults, and there are even non-compliance fines and other things that can affect, I guess, sort of the population getting vaccinated. So, for example, in Austria, the non-compliance results in fines are added up to 3.6k euros every 3 months. So again, it can come at large expense to the person for not being vaccinated. So it just depends on whatever country you're in to determine how much those fines can lead up to.
Yeah, I mean from an ethics standpoint, I don't know if it's necessarily fully right to charge someone 3.6k euros every 3 months if they don't want to do something to their body. But at the same time, from a logical perspective, and it is very strong in getting people vaccinated, and I think this is a smart measure that Austria has taken to get people vaccinated and certainly reduce the amount of COVID-19 cases. Because
And
I guess it's a
sorry,
conflicting idea.
sorry,
Yeah.
just for quick context, 3.6k euros to everyone else, sorry, to I guess our viewers is $3,778.
Yeah, that's quite a
So
bit of money.
it's quite a bit.
So yeah, as I was saying before, 3.6k euros every 3 months is quite a bit of money, and it is pretty strong in convincing the Austrian people to get vaccinated. But in terms from an ethical standpoint, I'm not really sure if it's right necessarily ethically correct to make people pay money because they don't want to do something to their body. Yeah, that's kind of all I really had to say.
I guess I can sort of see where you're coming from because I think while I did say that vaccines should be mandatory. I feel like $3,000 a month, especially for some people, is just a lot of money. So I feel like if we're gonna make vaccines mandatory in the U.S., if that does become a thing, one thing that definitely needs to be put in place is a reasonable fine, because I don't know if I agree with 3.6k or 3.7, I guess for American dollars, 3.7k. every 3 months. I feel like there are some problems there, but I do think that a fine would maybe be a decent idea, just not to that level of expense because then some people literally just couldn't afford it. And by getting vaccinated, there are expenses that come with that too. Like, for example, sick leave for some people just aren't covered by their company, so they won't be able to get the vaccine. That is a problem that some people deal with. So if we're not able to, I guess, target those problems and come up with something that works for both parties, then problems are going to arise. So we need to make sure that we can deal with that from the start.
Yeah, my idea, assuming that we just completely move past like the ethical talk that I was talking about, and we end up do making vaccines mandatory and do end up coming up with a fine, I think it should be charged or created based on the monthly or yearly income of the person that is being charged with this fine. I think like a
Yeah.
certain percentage should be taken so that way it's not harming people financially who come from different financial backgrounds, especially on the poorer side where it may be harder.
And I mean, for the people that can't afford it anyway, maybe there can be some programs put in place to help afford those. I mean, we have those in other aspects of, I guess, more of a low income stand. So these things are put in place already. It wouldn't be that much more. So I guess to some other countries, there are countries like Costa Rica, Croatia, France, and Italy where they're mandatory, but not for just all adults, for specific sections. So, for example, Costa Rica, it is mandatory for all state workers, but in Croatia, France, and Italy, it is mandatory for the public sector employees, which can include. Saj, do you want to go into that a little bit of what those include?
Yeah, it includes healthcare workers. Like basically, I guess it's not limited to necessarily like certain groups of people, but it's basically people that work in the public and do public jobs that are constantly working with the public. So like for example, garbage disposal workers, um, government employees, I believe, and various other people who are working with the public. And I brought this up earlier, I think. I really like the system of making, or I appreciate the system more of making it mandatory for all public sector employees because after all, these are the people that are working with the public and therefore it's easier for them to cause a spike in COVID cases if they end up catching COVID-19 because their impact on the public is on a grander scale than someone who's working in a more private sector or in.
And I guess it does give those private employees more freedom. Again, I can sort of see the standpoint behind this. I just feel like all adults are going to go out at some point. Like that is almost a guarantee. Like if someone, even if they are a private employee, they're still gonna go to like a party or the store. And if they're not vaccinated, if those things are happening, then those people are still going to be part of the problem in spreading COVID cases. And especially with new variants of these viruses, there needs to be some sort of mandatory vaccine in place just to make sure that we're all protected because at the end of the day it's not like only the public sector employees are the ones going outside. Again, they do a majority of it, but not 100%. And 100% coverage is not going to lead to, or is not going to be, um, I guess, a result of these types of vaccine mandates. So again, that's just more based off of preference, I guess, more of a logical side that I'm taking versus the ethical side you're taking.
Yeah, that basically sums up the argument pretty well. But going into President Biden's U.S. COVID action plan, as well as previous President Donald Trump's COVID action plan, I think there were problems on both sides of the spectrum, especially when Donald Trump was in office. I feel like they didn't really react to the virus quickly enough, and they didn't really treat it as an actual threat, and that's what caused the first spike that we saw emerging in early 2020. But looking at a little bit more of the previous, more recent times with the Biden administration, especially with the Delta variant, I feel like their approach to the Delta variant wasn't really the strongest because it was getting through to even some vaccinated patients. And and I feel like there needed to be more measures taken to work against this virus. Ashton, do you have any ideas on what they could have done?
Well, for example, one thing that they did was, I guess you sort of already touched on this, but there was the problem that the Delta variant came. Oh no, it's getting to people that have the vaccine. Let's use this new plan that focuses solely on the vaccine. I mean, again, you already sort of touched on this, but I feel like if they had just put in more measures like social distancing, masks, and made those completely mandated, maybe even enforced, I feel like there would have been a way better chance that the Delta variant could have been eliminated earlier on. Because, okay, from my opinion, the plan worked. I feel like there were less cases overall. But, especially during, like, the time of January 2022, where we saw, like, astronomical amounts of cases compared to normal, I guess. I think if we were to, um, be able to sort of enforce rules that kept the action plan, I guess, sort of in its own line. I guess keep it in check, keep the action plan in check of the action plan. I feel like there would have been a lot. It would have been way better, in my opinion.
Yeah,
Does
I
that sort of
think
make sense?
Yeah, I agree with what you're saying. I also think that the reason why there was such a huge spike in early to mid-January was because of the fact that families were traveling for vacation over that winter break time. I really do believe like that was a strong reason. People were traveling throughout the winter months, especially for Christmas and New Year that's celebrated in America. And so, what I think that could have been done better to specifically contain these cases at this point in time was to have people, honestly, like, what is it called, social distance, or even stay at their own homes for a week or two, just to let the any cases die down before kids go back to school. Obviously, this is kind of like not very a commonly shared idea amongst people, and normally in schools they just go back to school right after their 2 weeks of winter vacation. But I still believe like this could have severely reduced the amount of cases because after all, this is a pandemic and cases spread. And so that's what I really think caused the spike was people going on vacation, catching cases, and then spreading it as soon as they got back to school or their workplace, depending on their age.
And it also depended on the school. For example, my school, where I go to, there was testing twice every week during the time right after winter vacation. So as far as cases for our school went, there actually weren't that many. But like, Saj, does your school do testings?
Well, we had finals before we went on winter break. So when we came back, everyone was just kind of relaxed and ready for the second semester.
I meant COVID testings.
Oh, well, I'm sorry. COVID testing. We didn't actually have any COVID testing. Even later on that month, a little bit after the spike, people were really protesting and calling for mask mandates to be removed in school. And so I found that actually quite surprising, especially considering the spike in cases. But no, there was not any COVID testing or saliva samples. But I do go to a public school with more than 4,000 people. And so I'm actually really surprised that our school didn't really implement too many measures for us.
Yeah, I guess there's also differences between schools and districts, but especially for our school, once testing information got released for COVID testing and people saw how many cases there were, I think the first week we got back, there were many people that were sent home, and we actually had to isolate at our school. We couldn't go home. I go to like it's public, but I go to residential school. So I feel like even for our school, where people had to stay there and cases were slightly, I guess, more controlled is the right word compared to your school. I feel like there was definitely still a problem in which people were not facing proper I guess not facing proper, but using proper techniques to block out COVID, and instead just sort of doing willy-nilly and then coming back, seeing the information and being like, "Oh, I might have caused this." Like, I don't know. I just feel like if there were also more like effort given from the side of the like population, there these cases would have gone down. It's not necessarily all the fault of, I guess, just testings and like vaccines and those kinds of things. So I feel like the action plan, while it definitely had a problem there, the problem itself didn't lie within the plan. it lied within the lack of plan.
Yeah, I mean, going back to Biden's plan too, he proposed that people could have paid sick leaves to take time off of work to seek vaccination and recover from the side effects. And honestly, I think that would have been a decent idea, but I mean, I don't think it actually ever was implemented. So, I think there was an okay plan, at least in this department, even though I know you just criticized the idea that there was basically no plan at all. But for this area where there was a plan, it kind of didn't really come to fruition.
And also, I mean, it's not that I'm saying there's no plan. I'm just saying the plan didn't cover all aspects. When you're dealing with a government made plan for the entire society of the literal United States, and then you forget masks and social distancing and are very heavy focused on vaccines. Again, not saying they didn't do anything for masks and social distancing, but they could have done way more, in my opinion, especially during the holidays when people were going to travel. Winter 2021, no one wanted to be no one wanted to be in their houses at this time. Everyone was like ready to go, especially because that summer there were like especially during the times like late June, early July, there were almost no cases. So going from that jump to, or I guess going from that like drought to this huge jump of cases just shows vaccines aren't everything, and while they are a huge part, it's still not always enough. I mean, in like the U.S. alone, I believe it's like 70% of all adults are vaccinated. That might not be entirely true, but just that information alone is it's not everything. Vaccines aren't going to be everything, especially where it's not mandatory in all parts of the U.S.
Yeah, I definitely agree with what you're
And that was our 8th episode, so thank you guys so much for listening to the Metacopolis podcast. We hope you all stay tuned for next week's episode, and as well as what is to come in the future. Again, not everything we say in this episode should be taken at face value, and misinformation is a big problem, so make sure you do your own consultations with professionals who know the research and know the information. We're just throwing our opinions out there for the world to hear. Thank you.